Hi guys. It is Thursday, September 5th, I think. um, I just parked. I am at the Cleveland Clinic Family Health Center in Coral Springs, Florida. I'm coming for a second opinion regarding my lower back pain and the terrible nerve pain I'm having down my lower back, my buttock, my right leg, my right calf, right thigh, and then I have numbness and tingling in both legs. It's making it hard for me to walk for long, to stand for long. Can't really lift up my toddler. I just don't feel like I'm living, the way I should be living after having a lumbar fusion 7 months ago. So I went to a orthopedic surgeon yesterday. It was the third time I had seen him, also in Coral Springs. I just found him through my health insurance. I really didn't know much about him. I tried to see reviews. The reviews were okay, maybe like a 4 something out of 5, so it wasn't horrible, but my experience was. So this doctor had ordered a MRI, a CT, and a nerve test. I did all of them, and he also wanted me to get all of my my operative plan, my surgery plan from Laser Spine Institute, since they've closed down, and I haven't seen any surgeons since my surgery 7 months ago. I had to find a surgeon just because I knew, number one, a lumbar fusion is a major surgery, and I needed someone to look over my stuff, check my back out, make sure I was healing well. And because, number one, I'm in a massive amount of pain, and I know 7 months out, I shouldn't be feeling like this. I should be exercising. I should be working. I should be living a good life for a 38-year-old mom of 3. So it's been really hard. So I went to him. It was very disappointing. He basically had this "I can't help you" kind of attitude. I know in the community I live in, it's an older community. Actually, where we moved, it used to be a 55-plus community. It was recently that they let families move in. That's why we moved in. It's a very quiet, nice community, good schools. Problem is, it's an older community, 55-plus community. So the doctors around here are used to helping senior citizens. I guess, arthritis issues, hip issues, knee issues. I don't know the complexity of the cases they have, but I do know I'm being treated as though my case is so unique and so unusual that they just can't help me. So he read the MRI. He said he did see some mild narrowing and compression on the images. He doesn't know if that has anything to do with my pain. He does see that one of the screws from my fusion is kind of a little out of place. He again doesn't know if that's the cause of my pain. He read the MRI report. He read the CT report. The CT report clearly says I have neural foraminal stenosis at L3, L4, and L5. So foraminal stenosis is when the area that your nerves go through are being compressed, and therefore it's not giving the nerve enough room to do what it needs to do. They become compressed and they go haywire. This makes logical sense as to why I'm having major nerve pain. Guys, I'm getting electrical pains in my bum. I'm having issues. This is embarrassing. A lot of people wouldn't share, but I'm very transparent. If I get the urge to urinate, or as my 3-year-old says, do number one, I have to run to the bathroom. If not, I can't hold my urine. This is I'm 38. I've never had this problem before. Never had urinary issues. I have 3 kids. Some women, after having children, naturally, vaginal births, they may suffer a little bit of incontinence. May have some bladder issues after having children. That was not the case for me. I was able to use the bathroom normally. No problems after 3 children. This started about a month and a half ago. That's how I know it's fusion related. And I just wish doctors would listen to you. It's not all about what they see on images, but listen to the patient. Listen to their symptoms, to what they're telling you. Not all 2 cases are the same. So if you look at someone's images and they look like not a big deal to you, but the patient is telling you what they're going through, listen to them. Not all 2 cases are the same. Just because they have similar images doesn't mean one patient's paid free, this patient should be paid free as well. It doesn't work like that. Everybody's different. He basically told me, oh, I'm seeing some things, but again, I don't really have a plan for you. I can't tell you surgery is the way to go. I can't tell you injections are the way to go. I really don't know how to help you. All I would suggest is physical therapy. So how can one do physical therapy if they can't even stand or walk for long? I can't even lift my toddler. She's 30 pounds. What kind of physical therapy you want me to do if I'm always in pain? This is the point. This is why I need help. I need for someone to help me with the pain so I can continue to live my life. I want to exercise. I want to lose weight. I want to get out there. I want to return to work. I just want to have a normal life. So he tells me he can't help me. I said, so basically I came here, spent money on a co-payment, did all these tests for you, you're telling me you can't help me. So he says, I don't really want to tell you you need something when that's not what you may need. But he's an orthopedic surgeon. He should be able to give his opinion on what is needed. He basically told me he couldn't help me. Basically, that's what he told me. He set me up with a second opinion for one of his colleagues, for his colleagues to review everything. So then I said, but I read the CT and it says I have stenosis. So he goes, what? Stenosis? So he looks at the CT, I guess for the first time, the report, and he says, oh, it's saying you have stenosis. I'm not really seeing that, so I don't know if I could believe the CT report. What doctor says they can't believe the CT report? This is a CT that you ordered. Why wouldn't you take the radiologist's opinion on what's going on with me? If they're telling you I have stenosis at 3 levels, and I am telling you I have major sciatica nerve pain, I'm getting electrical pain down my bottom, why wouldn't you believe it? He just doesn't want to believe it. So I'm going to go get a second opinion from a neurosurgeon at Cleveland Clinic to see what their thoughts are. Oh, also, when we were finishing up the appointment, he tells me, how many months out are you again from the fusion? And I said, like I've told you before, 7 months. He goes, wow, you haven't fused at all. And I said, excuse me? He goes, yeah, there's no bone formation at all. You haven't fused at all. And I said, should I be concerned? And he goes, everybody's different. I said, are most people fused by now? He said, yeah, most people are fused 3-4 months out. And I said, and I'm not fused at all. And he goes, come to me in a year. If in a year you're still not fused and I see some things are more loose, then we'll go in and we'll do a revision. No, I don't want to wait a year in pain. I'm not fused now. That's a problem. So I'm going for a follow-up. I'm going to stay positive. I feel like today is a new day. I woke up with a different mindset. I just want to get things done. I'm going to try my best, despite the pain, to do some type of exercise and try to get strong and better. Sorry guys, my lips are very dry. Try to do just better. So I'm gonna see what he has to say, and then I'm just gonna try and do exercise and get myself better. Okay, so I'll let you guys know what happens. All right, thank you. Okay guys, so I met with Dr. Roski at Cleveland Clinic, Coral Springs. He's a neurosurgeon but doesn't perform surgery. I looked at everything, asked me why I had a fusion, and I said, well, the doctors determined that I had instability of my lumbar spine. And he said, based on what? I said, well, I guess based on the MRIs and my medical reports. And he shook his head. He asked me where I had it done. I said, Laser Spine Institute. And he said, of course. I guess he has a negative view of Laser Spine Institute, so he gave me some x-rays, looked over my stuff. He says he doesn't have an answer exactly for what's going on with me, so he made a referral to kind of like a expert at Cleveland Clinic in I guess neurosurgery and the spine. His name is Dr. Duckwar. He's out of the Cleveland Clinic in Weston, Florida. So I have an appointment to see him tomorrow. And that's where we're at. So it's kind of like, you know, when people don't have an answer for you, they pass the buck. But I'm just going to follow through, and I'm going to see Dr. Duckworth tomorrow, and I'm going to keep it moving.